Welcome to Mount Sinai West Hospital. Thank you for choosing our institution to have your surgery. We are committed to making your hospital experience and recovery our top priority. This class is designed for patients undergoing total hip and knee replacement surgery. The goal of this educational class is to help you prepare for your upcoming surgery and to understand what to expect throughout your joint replacement journey.
Hello, I'm Jody Holmes, and I'm the nurse manager for the inpatient orthopedic surgery unit here at Mount Sinai West. On behalf of the treatment team, I would like to welcome you to Mount Sinai West and thank you for choosing our esteemed providers for your joint replacement surgery. Together with your interdisciplinary team, we will get you up and moving the same day of your surgery. You may be discharged on the day of your surgery, but if not, it's our goal to get you home by 12 p.m. on the next day. We're dedicated to providing you with exceptional service and a great inpatient experience. If you have any needs throughout your hospital stay, please reach out to me, Jody, or a member of your treatment team. We look forward to caring for you soon. Hi, welcome to 10A. This is the inpatient orthopedic surgery unit here at Mount Sinai West, where you'll recover from your orthopedic joint surgery. It's currently October, which is the reason for all of the Halloween decorations. But here on 10A, movement heals, and we look forward to seeing you soon.
Hi, I'm Kate.
And I'm Lindsay, and we're physician assistants with the orthopedic team.
And we're going to walk you through how to prepare and what to expect for your upcoming joint replacement at Mount Sinai West. Welcome to our pre-op education class. The first part is the video. This is going to tell you what to expect during your hospital stay. It's going to go through physical therapy education, social work education, nutrition education. The second half of your class will be a one-to-one individual session with a physician assistant. We will go through your medical clearance, your medical history, and answer all questions and concerns. Home medications. Please stop taking the following 1 week prior to your procedure: all anti-inflammatory medications, vitamins, herbal or natural supplements. Refer to your primary care physician or specialist regarding all other medications. Let us know if you were taking aspirin or any other blood thinners. During your admission, your provider may convert your home medications to an equivalent hospital formulary medication. We will ensure that you have all of your home medications. Please see below for some hospital conversions. We take special consideration for the following medications used for diabetes and weight loss. For example, Ozempic, Wegovy, Mounjaro, Trulicity. These medications need to be stopped at least one dosing interval before surgery. Pre-operative testing. The following should be completed before your individual meeting with the physician assistant: blood work, EKG, chest x-ray if necessary, a letter of medical clearance by your primary care physician or cardiologist. Please contact your surgeon's office to confirm your medical clearance was received. 5 days prior to your surgery, as well as the day of your surgery, please use HibaCleanse to wash the operative leg. Use about 1.5 teaspoons on a washcloth and apply it to your operative site. You may purchase the HibaCleanse over the counter or speak to your surgeon's office to arrange picking up the preoperative wash. Please refrain from using any body lotions or shaving the extremity 1 week before surgery. For at least 72 hours prior to surgery, please do not smoke, drink alcohol, or use recreational drugs. These may interfere with the anesthesia medications. If you develop a cold, virus, sore throat, or other illness during the week before your scheduled surgery, please contact your surgeon's office. It will be determined whether your procedure should be rescheduled. What to bring the day of surgery: comfortable, loose clothing and supportive shoes or sneakers, a government-issued photo ID, your insurance card, and a prescription card, a list of all your medications that you are currently taking, credit card for co-payments for discharge medications, durable medical equipment, and transportation, cell phone and cell phone charger. On the day of surgery, do not wear contact lenses or body jewelry. You may wear eyeglasses, hearing aids, or dentures. However, these must be removed prior to your surgery. Please bring your containers in which you store these items, and do not bring any valuables or jewelry. On the evening before your surgery, you will receive a call to let you know the time of arrival for your surgery. Please arrive at the patient entrance for ambulatory surgery listed below. The entrance is located next to the emergency department. 8 hours before your surgery, stop eating solid foods, but you can continue to drink clear liquids. Before you leave for the hospital, drink up to 16 ounces of the following: Gatorade, any color except red, black coffee or tea with no milk or creamer, water. Your case may be canceled if you do not follow the above instructions. Special consideration for patients taking medications used for diabetes and weight loss. Please refer to the eating and drinking guidelines provided to you by your surgeon's office. If you are taking these medications, please let the physician assistant know during your one-to-one meeting. They will discuss these guidelines with you in more depth. Check-in. Please arrive on time. You will arrive at the ambulatory surgery entrance and be directed to the 5th floor. There are multiple parking garages around the hospital. There are 2 garages on 59th Street between 9th and 10th Avenue. After check-in, you'll be taken to the pre-operative holding area. You'll be greeted by the nursing staff, change into a gown, and have your vitals taken. Security will take your valuables to a safe location. You will have a hospital ID bracelet put on your wrist. For your safety, you will be asked to verify your name and date of birth multiple times on the day of surgery. This is to ensure you are getting the correct treatment that is planned for you. What to expect the morning of surgery. You will meet a member of the orthopedic and anesthesia team. You will have time to discuss any questions or concerns. You will sign consent forms, and your operative site will be marked by your surgeon. The anesthesiologist will meet with you prior to your surgery to discuss your anesthesia and answer any questions you may have. An IV will be placed in your arm, which will allow medications to be given to you so you're comfortable throughout your procedure. If you have had any experiences in the past with anesthesia, please inform the anesthesiologist at this time. It is important that they have all information possible to provide the best anesthesia care for you. You will receive a one-time therapeutic dose of an iodine-based medication to get rid of the MRSA and MSSA that lingers in your nose. If you have an allergy to iodine, you would have been prescribed Bactroban preoperatively to apply in your nostrils twice a day for 5 days before surgery. Recovery room. After the surgery, you will be taken to the PACU, a unit where you'll be closely monitored. You will notice a bandage and ice pack around your operative site. You will be evaluated by a physical therapist in this area. You will be asked to rate the severity of your pain using a pain scale, 0 being no pain and 10 being the worst pain. There is no right or wrong answer, just rate your pain as best you can to give us an idea of how close we are to making you comfortable. Ice packs will be placed to help with pain and to decrease inflammation. Always tell your doctor, nurse, or other staff member when you are having pain. Methods to help assist with pain relief are relaxation techniques, rest, deep breathing exercises, and proper positioning. Welcome to our orthopedic unit. Unit 10A, designed for patients who have undergone total hip and knee replacements. Includes a specialized staff of nurses, physical therapists, physician assistants, social workers, nursing assistants, and secretaries who all help to make your recovery as smooth as possible. You will be seen by a nurse or nursing assistant every hour throughout the day and every 2 hours overnight. You will get to meet other patients who have undergone similar surgeries. Bedside equipment. You will have a cooling and ice machine, SCDs, incentive spirometer, call bell, TV remote, and a whiteboard with your surgeon and nurse's name. Daily rounds. Your surgeon and his or her assistants will evaluate you every morning and throughout the day. Physical therapy. You will be assigned to a physical therapist who will evaluate you and then help with walking and start range of motion exercises. You will also be assigned an occupational therapist who will help evaluate and perform activities of daily living with your new joint. And lastly, a social worker will visit you on the first day after your surgery to ensure you are set up with a smooth discharge plan. It is important to clear your lungs post-operatively to prevent pneumonia. We do this with the following methods. Incentive spirometer. The nursing staff will help educate you on how to use this device. It is designed to help you take deep breaths, and we encourage you to perform this 10 to 20 times every hour. Lung exercises. Coughing and deep breathing should be performed several times every hour. And sitting upright. It is important for you to sit up daily. There is a recliner chair next to your hospital bed for this purpose. Preventing blood clots. Walk every day. Anticoagulants. These are medications to keep your blood thin and to prevent clots from forming. This medication will be prescribed to your pharmacy upon discharge. A few examples are aspirin, Xarelto, and Eliquis. Sequential compression devices. These devices will be placed on your lower legs while you are in bed. They inflate and deflate periodically to improve blood flow. Antibiotics will be given to you through your IV for the first day as a preventative measure. While admitted, the orthopedic team will provide daily wound care to ensure the incision does not become infected. For patients with diabetes, it is important to keep your blood sugar under control. We have a few weeks to get this joint moving. It is important to begin bending and straightening your knee immediately after surgery. This will be done initially under the guidance of physical therapy, and you will need to do this on your own multiple times a day. On day of discharge, you will receive prescriptions for pain medication, blood thinner, stool softener, and other medications that will be determined by your surgeon. Durable medical equipment. You will also receive detailed instructions from your nursing staff and orthopedic team for continuation of medications, wound care, exercises, and follow-up. And lastly, vaccinations. Equipment after surgery. You will be discharged home with a walker. We encourage you to purchase a hip kit, which is a great recovery tool for patients undergoing hip and knee replacement. It includes a sock aid, dressing stick, reacher, shoehorn, and elastic shoelaces. After your discharge from the hospital, you will receive a phone call from the orthopedic team within the next few days checking in on your home recovery. You should make a post-op appointment with your surgeon's office. You should continue taking the oral anticoagulant, and you should continue doing home exercises advised by your therapist. If you have any questions while at home, please call your doctor's office or home care agency. For an emergency, call 911. Our hope is for you to continue living a healthy lifestyle. Continue to exercise and walk daily. Maintain a healthy weight, be mindful of your daily nutrition, and smoking cessation. Our goal is for you to have a safe and positive experience while at Mount Sinai West Hospital. We encourage you to push yourself as much as you can. We give you all the tools and assistance while you are with us to make your orthopedic surgery a huge success. Please remember to walk every day.
Hi everybody, my name's Greg. I'm one of the orthopedic physician assistants here at Mount Sinai West. Right now, we're in the holding area. This is the area where you'll be directed to shortly after you check in. While you're here, you're going to be meeting a lot of different people, from medical billers who will be reviewing your demographic information as well as your insurance information, from our nurses who will be reviewing your medical history, from the surgical team and the surgeon who will be going over your operative plan, and with the anesthesiology team who will be going over how they will be keeping you safe and keeping you comfortable during your surgery. Many of the questions that we ask do happen to overlap. We apologize for this, but there is certain information that we have to hear directly from you. We also ask that you may have to fill out a short survey if one has not already been done at your surgeon's office. We look forward to seeing you, and thank you very much for choosing Mount Sinai West for your surgery. Have a great day.
Hi there, my name is Jason Lee, and I'm an anesthesiologist at Mount Sinai West, and I'm also the Director of Quality Assurance for the Department of Anesthesiology. Today, I just wanted to give you a brief overview of what to expect when you come for your surgery for your total joint replacement. When you first come to the hospital, you'll meet the nurses who will do your intake and get changed. As you approach closer to your surgery time, you're going to meet members of the anesthesia team who will go through the process of getting you ready for the surgery and telling you more about the anesthesia experience. First, your anesthesiologist will sit down with you and discuss your medical history and review all the information that was obtained from your primary care physicians and the various specialists that you see on a regular basis. This includes any documentation about your past medical history, your labs, and any special tests that were performed to make sure that you're fully ready to undergo anesthesia and have your procedure done. After your history has been reviewed, your anesthesiologist will then review your two options in terms of the anesthesia that we can provide you. Our two options that we provide at Mount Sinai West consist of neuraxial anesthesia, otherwise called spinal anesthesia, or general anesthesia. Your surgeon and anesthesiologist will likely suggest that you undergo spinal anesthesia. This is a small procedure that's performed in the operating room before the surgery starts. After an IV is placed, you will receive a little sedation through the IV, and a small injection will be performed in your lower back. After the injection is done, you'll start feeling numbness from your belly button down to your toes, and a small infusion of sleeping medication will start so that you sleep through the rest of the surgery. Spinal anesthesia will make sure that you feel no pain, and it will wear off about 30 minutes to an hour after the surgery is done. The alternative to spinal anesthesia is general anesthesia, which is always our backup if there are any issues with spinal anesthesia. General anesthesia consists of IV medication given to you to get you fully off to sleep. You will be so asleep and so comfortable that your anesthesiologist will perform a small procedure to protect your lungs and make sure that you're breathing well, called intubation. At the end of the procedure, you will wake up without the breathing tube, and you will be nice and comfortable, ready to go to the recovery area. Your anesthesiologist may also consent you for what's called a peripheral nerve block. This is a small ultrasound-guided procedure performed to provide some extra pain relief on top of the oral pain medications that you may take. This injection won't take away all the pain, but it will significantly reduce the amount of pain you may have and the amount of medications you may need to take during the first 12 hours after the surgery. Our team is passionate about providing quality anesthesia care, and we look forward to meeting you on your big day. Thank you very much.
Hi there, my name is Michał Sokolowski. I'm a senior physical therapist on orthopedics, and this is some of our team that you might be seeing while you're recovering from your surgery.
Hi, my name is Lloyd. I'm a physical therapist.
My name is Casey. I'm also a physical therapist.
My name is Shannon. I'm also a physical therapist.
My name is Dorothy, also a physical therapist.
My name is Kathleen. I'm a senior occupational therapist.
My name is Nicole. I'm also an occupational therapist.
My name is Jackie. I'm also an occupational therapist.
So my name is Casey and I'm from physical therapy. I'm going to be talking about the rehab protocol after you have your total joint replacement. After you have surgery, you'll be seen by both physical and occupational therapy. Occupational therapists are there to help you improve your ability to perform daily activities such as dressing and grooming, and you'll see occupational therapy once a day. And physical therapists are there to help you relearn how to transfer, walk, and climb stairs. Physical therapy will see you either 1 to 2 times a day. PT and OT, both of our goals is to get you independent to go home. So we have some goals for rehab. We're going to get yourself in and out of bed, walk safely with an assistive device, go up and down stairs if that's what you need to do in order to go home. We'll go over your basic exercises that you can do, and we'll also make you aware of what movements are encouraged, as well as what movements, if any, should be avoided. So the day of surgery, physical and occupational therapy will either see you in the recovery room or on the orthopedic floor. At that point, our goals are going to be to sit up at the edge of the bed, And then we'll just try to stand using the walker, and then we'll walk, and we'll begin basic exercises. The day after surgery, we'll have you transfer out of bed into a chair. We'll have you continue walking with an assistive device. We'll go over exercises in bed and the chair. The nursing staff will assist you back into bed when you're ready. And then physical and occupational therapy will discuss any equipment needs you might need before you go home. And we'll also practice going up and down the stairs if that's what you have to do. And most of you will be going home on this day. So in your binder, there's handouts of exercises that you can look at and go over before the surgery, and we'll go over them again as well. These exercises you'll perform 3 times a day while in the hospital and continue at home. And on this side, you can see 2 of the basic exercises that you can start to do. The one on the left is called ankle pumps, where you just point your toes up towards the ceiling and then bring your heels up towards the ceiling. And then when you're sitting in a chair, the exercise on the right is called a long arc quad. So what you're going to do with the surgical leg is you're going to extend your knee, trying to straighten your leg as much as possible, and then bring it down to the ground.
So my name is Jacqueline Anderson. I'm from occupational therapy, and I'll be discussing the durable medical equipment. So for durable medical equipment, you may need a walker, cane, commode, tub bench, or tools for dressing. Some of this equipment may be covered by your insurance. Other equipment may require a copayment or full purchase. We also provide in-house vendors for some of the equipment, or you can purchase items from your local surgical supply store or online vendors such as Amazon. Please keep in mind some patients may not need any adaptive devices outside a walker or a cane. And for any equipment ordered, please follow up with the vendor or social worker. For home safety, at discharge, please have someone to accompany you. Please have a pair of loose rubber soled shoes to wear in the home. Make sure your chairs are firm with armrests. You can add pillows to low couches and chairs if necessary. Clear clutter and avoid throwaway rugs. Please be mindful of pets and be careful when walking on different surfaces. Safety in the kitchen, some things to keep in mind: prepare meals ahead of time or plan for meal or grocery delivery. Organize kitchen to have items in reach to avoid bending or reaching in high-low surface areas. Safety in the bedroom, tape down or remove cords from walkways, have a clear pathway, and reorganize clothes to make items easier to reach. For safety in the bathroom, organize the shelves prior to surgery, making sure all frequently used items are easily accessible, and make sure the bathroom doorway has a clear access. Your patient responsibility. Do your best when the PT or OT comes to see you. Try to perform your exercises at least 3 times throughout the day once you go home. We want your surgery to be a success and your recovery process to go smooth as possible. Thank you for coming.
Hi there, my name is Michał Sokolowski. I'm a senior physical therapist here at Mount Sinai West. So after your total joint replacement surgery, the best thing you can do is to ambulate, change positions throughout the day as much as possible. The worst thing you can do is stay in one position in bed all day. It puts you at risk of a lot of complications. So taking little walks to the kitchen, to the bathroom, doing as much on your own as possible is the most important. In your discharge paperwork, you will get a set of basic exercises to do at home. You will also go over them in your joint class. I suggest that you go through them already so you're comfortable doing them at home before you even have the surgery. It's a lot easier to tap into that muscle memory to do the exercises than to learn a new exercise when you arrive in the hospital. So the first exercise is very simple. It's called a quad set. For all these exercises, the frequency is listed on the handout. It's 3 sets of 10, 3 times a day. So we're shooting for about 90 repetitions per day. Especially after a knee replacement, you might want to space those exercises more frequently. So maybe a set of 10 every hour just to keep that knee nice and loose. So the first one, you're going to work on knee extension in bed, laying flat. So you're going to press straight down into the bed, contract the quadriceps muscle, maintain that contraction for 5 seconds, and then just relax it. And that counts as 1 repetition. So we're shooting for 10 of those. Very simple exercise. just gets that knee into full extension in supine. The second exercise, now we're focusing on knee flexion. So you're going to slide your heel towards you as far as you can. There you go. Cat has beautiful range of motion. You will not have that range of motion after surgery, but we are aiming to stretch that knee. So you can extend it back down, slide it back. This might be difficult after surgery just because of pain and swelling. Still very important to push through that pain and swelling to get that knee range of motion. So what you can do is you can use your hands on your thigh to help pull that leg towards you to get more of that stretch. Or an alternate method is you can, if you have a strap at home, you can use a strap. If you don't, a rolled up sheet works just fine. You can hook that sheet under your foot and just use your hands to pull that leg towards you. Perfect. All right. Perfect. The next exercise is called a straight leg raise, SLR for short. So you can bend the opposite leg just to relieve some pressure on your back. And then you want to raise your leg straight up. And again, cat has great flexibility. You can go to about the height of the knee on the other hand, and that will be great. That's a very difficult exercise to do after a knee replacement. Should be a little bit easier after a hip replacement, but still a challenge. Again, you can use that rolled up sheet to help pull it up. Perfect. The next one is a terminal knee extension. So you can have a rolled up sheet or rolled up pillow underneath that knee, right? So you see how that knee now is in a little bit of flexion. Here, a note of caution, this position does feel great after a knee replacement. Do not leave that pillow under the knee. You want that knee nice and straight when it's in bed, and the physical therapist here will definitely stress that when they see you. But for the exercise, you're just straightening the knee. There you go. Nice and slow, and then back down. Perfect. Okay. The most basic exercise after a surgery, it helps prevent blood clots and diminish swelling. It's called ankle pumps. This you can do on both legs, just full plantar flexion, dorsiflexion. So moving your ankles up and down, nice and slow. And those you can do if you're watching TV, every commercial break. Again, the recommendation in the handout is 3 sets of 10, 3 times a day. But these I highly recommend that you do more frequently throughout the day. And you can do those laying down or sitting up. Okay, and the final one, you can sit up. Again, this exercise is predominantly for knee replacement patients, but you can do those after a hip replacement as well. We're going to work on that knee extension and flexion again. So this is for extension. Nice and slow. Try to not rely on the momentum. And again, after a knee replacement, this exercise will be very difficult to complete. And you can modify it with either a strap or a rolled up sheet, just to again stretch that knee, make sure that that scar tissue is not forming in a way that it restricts your range of motion. Very nice, so that's for extension. If you scoot forward, then you can focus on flexion and sliding that heel under you, forward and back as far as you can. And again, Kat has full range of motion, so this is a lot easier for her than somebody after a total joint replacement. And you can use the other leg to actually push the leg forward and back as well. It's a lot easier if you have some back support for that one, for the modification. Again, the physical therapist will go over all these exercises with you when you're here after your surgery, and if you have any questions about them still, make sure to ask either a PT or an OT.
Hi, I'm Stephanie Flam, and I'm an inpatient social worker at Mount Sinai West. A social worker will contact you prior to surgery to assess your existing functional needs and resources and to discuss the discharge plan anticipated for you following your surgery. If you have concerns about managing at home following discharge, you can discuss them with your social worker prior to surgery. The social worker will collaborate with your doctors and therapists to formulate and execute a personalized discharge plan on the day of your surgery. There are daily rounds where your team will meet to discuss your progress, needs, and concerns. Once we have formulated a discharge plan, a social worker will facilitate any recommended services for discharge. If you are recommended for home care services upon discharge, including home PT, nursing, or occupational therapy, a social worker will assist in arranging these services. You will be provided a list of certified home health agencies, and a social worker will refer you to an agency that is both in your area and in network with your insurance. Once your case is accepted and confirmed by the agency, you will receive a call from that agency to initiate care once you are discharged. Home care services usually begin within 24 to 48 hours of discharge whenever possible. Contact information for your home care agency will be available in your discharge paperwork should there be any issues following discharge. Depending on insurance coverage, a physical therapist will come to your home between 3 and 5 days a week. Complete duration of therapy is between 1 and 3 weeks post-surgery. Most patients have 2 weeks of in-home therapy. The goal of intensive therapy is to get you back to your normal life in your home faster. This option is explored for those few patients who would not be safe at home based on the evaluation by the team. This level of care consists of a few hours of therapy daily in a skilled nursing facility. The social worker will provide you with a list of rehab facilities in your area, and you will be referred to the facilities of your choice that are in network with your insurance. You can check out the list of skilled nursing facilities online at www.medicare.gov. When you have been accepted to a subacute rehab facility, the social worker will inform you of the accepting facility. Social work will collaborate with the team to obtain authorization from your insurance as needed. Prior authorization can be immediate or can take several days. Social work will help facilitate your transfer via ambulance once confirmed and authorized. At subacute rehab, you'll participate in 1.5 hours of PT daily, and average stay is about 2 weeks. The following are not usually covered by your insurance, although we are able to arrange these services if needed. Transportation from hospital to home, in some instances transportation to rehab center, private nursing home attendant care, some durable medical equipment. Each insurance plan is different, and we are happy to explore your individual plan's allowances with you post-surgery. And finally, we want you to get back quickly, safely, and comfortably to your new old self. We are here to help. Please feel free to contact the social worker before, during, or after your admission if you have any questions regarding the discharge plan.
Hi, my name is Elise. I'm one of the dietitians here at Mount Sinai West, and I'm going to be talking to you a little bit about some strategies to optimize your nutrition both before and after your surgery to get you back on your feet as soon as possible. So first we're going to talk about some strategies to get your body ready for the surgery from a nutrition perspective. It's going to be really important that we are fueling your body properly to prep in advance of the stress that the procedure is going to put on your body. It's going to be important to include protein 1 to 2 weeks before your surgery, making sure that you are including a protein at every meal and snack. So that can be from an animal source such as meat, eggs, chicken, poultry, fish, or it can also come from our plant-based sources such as tofu, nuts and seeds, as well as beans. It's really important to include protein because protein does provide building blocks for muscles, bones, and it does also strengthen your immune system by promoting the production of antibodies. Protein is going to allow you to be as strong as possible going into surgery. We do also want to make sure that you are stocking up on your fruits and vegetables prior to surgery. Our fruits and vegetables are a great source of various vitamins and minerals, including vitamin C, vitamin K, iron, and magnesium that are all going to be helpful both prior to and following your surgery. And vegetables and fruits also help to support a healthy immune system, promote regular blood sugar levels, and reduce overall inflammation. Typically, the darker the vegetable or fruit, the more nutrient dense it's going to be. Another thing that's going to be really important pre-operatively is going to be adequate hydration. Studies have shown that patients who are well hydrated prior to their procedure report overall less pain and nausea following the surgery. So we want to make sure that you're drinking at least 8-ounce glasses of water per day. And we do want to try to limit our consumption of foods that are going to cause increased stress on the body, such as sugar, alcohol, and caffeine. It's not to say that you can't have any, but we do want to make sure that we are trying to limit any excess stress and inflammation that can be put on the body prior to your procedure. This is also very important for our diabetic patients. We want to make sure that you're reducing any intake of sugar-sweetened beverages and excess sugar intake to help promote blood sugar control and reduce the risk of inflammation, infection, and increased wound healing following your procedure. So after your procedure, we want to make sure that we are fueling your body to get you back on your feet as quickly as you can. Nutrition is going to be a really important part of that. So again, we're going to talk about some components that can help you get on your feet as quickly as possible. Protein, once again, is going to be really important. As we discussed, it promotes wound healing. It also helps to repair the damaged body tissues and keep your immune system strong. And it's going to come from those sources that we previously discussed, both animal and plant-based proteins. Vitamin C is also really important in the post-operative stage, as it helps to heal wounds as well as form collagen in bone, muscle, and skin. You can find this in a variety of fruits and vegetables, but primarily vitamin C is going to be found in those citrus fruits as well as strawberries, kiwi, potatoes, peppers, broccoli, and kale. Vitamin A is also really important during this stage because it helps with skin healing, cell growth, and it does also support the immune system. Vitamin A is typically found in our orange fruits and vegetables as well as our dark leafy greens such as kale and spinach. Zinc is also really important for wound healing. You're going to find that primarily in fortified dairy products and cereals as well as lean red meats, sesame, and pumpkin. Vitamin D and calcium are going to be both really helpful for maintaining our bone strength, and calcium specifically is also important for activating many enzymes throughout the body and contributes to blood clotting, which are important in the post-operative phase. In order to make sure we're getting enough calcium and vitamin D, we want to look to our milk sources as well as calcium-fortified juices, cereals, and dairy products. Vitamin D specifically can also be found in egg yolks, salmon, and sunlight, and calcium can be found in those dark leafy vegetables, especially broccoli. Another food component we want to highlight in the post-operative phase is omega-3 fatty acids. These are going to be really important for preventing or helping to eliminate excess inflammation. They can be found in our plant oils such as flaxseed oil, as well as avocado, fatty fish, nuts, and green vegetables. One of the most common complications following surgery can be decreased appetite. It's very common in the post-operative phase, but that does not mean that our body does not need increased calories and protein. As a result, we want to make sure that if you are finding it difficult to eat your baseline portions of food, that we are utilizing some strategies to help combat that. Transitioning from 3 big meals a day to 5 to 6 small meals a day can be a strategy to help increase your overall intake of calories and protein. And including high-calorie, low-volume foods such as avocado, olive oil, dairy products, and nuts and seeds can also be very helpful when trying to increase your overall calorie and protein intake and pack a punch in each bite that you're eating. Another strategy to help combat decreased appetite is to drink your calories. So that can either be from a smoothie made at home that includes maybe your favorite nut butter, a fruit, vegetable, protein powder, as well as your milk of choice. And you can also find this in your pre-made nutrition drinks that you can find at a local drugstore, such as Ensure or Boost. Another strategy that can be helpful is working with a dietitian, both or either in or out of the hospital, on some ways that you can optimize your nutrition post-operatively. Constipation is another concern that comes up in the post-operative phase as a result of decreased movement and some of the pain medications, which are known to be constipating. In order to combat that, we want to make sure that you continue to stay adequately hydrated, drinking at least 2 liters of fluid a day, and we also want to make sure that you're including those high fiber foods at each meal. So that would come from your fruits, your vegetables, and your whole grains, which will also help to get you your vitamin and mineral requirements. Fiber, especially our insoluble fiber found in our nuts and seeds, as well as fruits with the skin on, and our leafy greens are going to be really helpful for maintaining normal bowel function. So those are some of the things we're going to want to include on a daily basis. And this is just highlighting a lot of the topics that we had discussed. We want to make sure that, again, you are staying adequately hydrated prior to your procedure, and that you're making sure that you're including a lot of fruits and vegetables that have both that fiber, vitamin, and mineral component to them. We want to make sure that you are eating enough in the post-operative phase and meeting those increased calorie and protein needs through smaller, more frequent meals, as well as protein-packed snacks. We do also want to make sure you're avoiding any excess stress on the body by continuing to limit our consumption of excess sugar, processed foods, and alcohol. And if you do find that you have any questions or you're concerned that your appetite has remained low in the post-operative phase, feel free to reach out to a dietitian to help. Thank you.
We would like to thank you for trusting us to provide you with excellent care. We hope you feel more confident and prepared for your journey ahead. The second part of the pre-op educational class will consist of an individual meeting with an orthopedic physician assistant. We will answer all of your questions at this time. Thank you for choosing Mount Sinai West for your care.